As the pandemic lessens and schools aim to reopen in the fall, the question becomes how? How do they reopen and how can they keep their students safe? DataRobot, an organization focused on combating COVID-19 and helping schools reopen, has introduced a new platform, a new plan to help these schools do just that. Sally Embrey from DataRobot joins us today to break down their new program, answer the questions about it, and so much more. That's all coming up right here, right now. I'm Sam Chen, and this is Face the Issues. Good evening and welcome to Face the Issues. I'm Sam Chen. The debate about reopening schools has shifted over time from if to when, and now from when to how. Everybody wants schools open, parents want their kids back in the classroom, but the question is, how do we do it safely? DataRobot is an organization that has been working on this question, and they've got a solution that they have pitched to schools. They're partnered with the United States Department of Health and Human Services, the Children's Hospital of Philadelphia, and Sally Embrey from DataRobot joins us today to talk about this new platform. Sally, welcome to Face the Issues.
Hi, thank you so much for having me.
It's good to have you here with us. You serve as Vice President of Public Health and Health Technologies at DataRobot. And just so our viewers know, you have a background in engineering and epidemiology yourself.
That's correct, yes.
We are dealing with the experts, so thank you for taking the time to join us. Sally, before we even jump into this, it has been a chaotic year and several months. How are you and your family doing?
Oh, thank you for asking. It's been a lot of long nights and weekends, really trying to do everything that we can to combat the spread and bring about solutions in the space. But on a personal level, I've been very fortunate, and my family has been very fortunate to stay safe and healthy throughout the pandemic.
Good. That's good to hear. And we certainly appreciate the work that you're doing. We're going to get into some of that here. As we get started, a lot of our viewers may not have heard of DataRobot, and obviously this new platform, this rapid testing program that your organization is introducing. So tell us a little bit about who you are first. What is DataRobot? Is this a healthcare focused company? Is this a data company that is currently working on healthcare? And then tell us about the rapid testing program and what it is that you and your organization aim to do.
Yeah, of course. So DataRobot is traditionally an enterprise AI software company. So what that means is we help automate artificial intelligence and machine learning. And we have a platform that allows you to have those machine learning tools and makes essentially an ability for you to insert AI and ML into everyday life very easily. So it automates certain things for data scientists, and it will help non-data scientists get an introduction to how they could be using AI and ML in their workspace as well. We are industry agnostic, so we work with a wide range of healthcare companies, but we also work with manufacturing companies, banks, insurance agencies, you name it. If there's an opportunity to build models off of your data or help bring artificial intelligence into your workflow, we're there to help. At the beginning of the pandemic, though, we actually reallocated 50% of our R&D resources to fighting COVID-19 from a data science perspective. So we saw high-level decision makers that were using models in order to understand where COVID was spreading or how they could best be understanding the severity of cases. And we were disappointed with the quality of those models. We didn't think that they were accurate enough to really drive true decision-making on the ground. So we started building our own. We have a reputation for being a little crazy like that at times. And that allowed us to build relationships with folks that you mentioned, HHS, CDC. And from there, we started working on a range of different problems, from forecasting models to understand where spread was occurring, hospital utilization, and now things like reopening K through 12 schools. And so we do that through our rapid testing app. And the rapid testing app essentially helps easily connect school systems to the national, local, and state reporting systems to help ease the burden around required reporting for antigen tests, and hopefully helps reopen schools safely and protects the teachers and administrators as well.
So this program that you're introducing is really based on testing. This is not about vaccinations, especially if you're dealing with K through 12. A lot of them are not yet eligible for the vaccine. So this is really driven by testing.
That's correct. Yes, it's almost all based on antigen testing, which is a certain type of easy test. Essentially, it takes like a lower nasal swab, non-invasive. You swab your nose, wait 15 minutes, and get to see an understanding if you're positive or negative for COVID-19.
Understood. Where are you aiming to do this? You are partnered with the Children's Hospital of Philadelphia, the top children's hospital in the country, and again, CDC, HHS, and you are already in several school districts and schools throughout the state of Pennsylvania. Is the aim Philadelphia region, Pennsylvania, or nationally? What's the hope and the goal of where you want to be?
Yeah, we started in Philadelphia because of the strong interest of Children's Hospital of Philadelphia. They were already putting a system into place, and we helped basically use technology to infuse that system and make it easier for the teachers and administrators. We also have a program in Seattle, and we are open to working with many municipalities, states, basically wherever people need help. We would like to be there with our solution if they need us.
So it's not regionally. There's no area that you are not going to go to if given the opportunity.
No, if there's an opportunity and people are interested in using antigen testing to reopen schools safely, DataRobot wants to help.
Excellent. So let's talk about the program itself. You said it's based on antigen testing, which you explained to us what that was. Now, how does this work? Because the program and on your website, you talk about not just seeing who's negative and positive, but even the potential of projecting possible outbreaks before they occur, before they develop. How would that work?
Right, that's a great question. So the program itself is understanding, using antigen tests, if there's a potential for an outbreak within a school, testing the student population and administrators and teachers at a frequency they feel comfortable. And those results get reported into the local, state, and federal systems for COVID-19 reporting. And the reason why that reporting is essential is because DataRobot has built very accurate forecasting models around understanding how the disease spreads in certain communities. And we can get very granular in terms of our understanding of where spread is likely to occur if there's a big increase or even a moderate increase in the number of positive cases. So the data that we help collect feeds into these national and local systems so we can actually build better predictive models at a more localized level. And then we can give a better alarm on if we believe there's going to be a resurgence in cases. So we don't have the data on an individual level. We don't track individual kids or understand the positive and negative rates of an individual person. We look at it at a population level. But if we can get more granular information at a geography, so think of it in terms of where cases emerging at a zip code level, then we can allow public health authorities to take more proactive measures in that space.
Sure. So this comes back to the basic idea: the larger the sample size, the more accurate your projection, and the smaller the margin of error.
Correct. Absolutely right.
Okay. So is it beneficial then to be utilized, for example, if you're in one school district in the Philadelphia area, is it beneficial, the more school districts that join, the better understanding you would have of that Philadelphia region, of that zip code, as opposed to saying just one school here, one school somewhere else on the map, and so forth?
Throughout the pandemic, as we were building those forecasting models that projected where cases were going to emerge, there was two trends that really kind of underlined how to stop the spread of COVID-19 most effectively. And one was access to frequent, affordable testing. And so that doesn't have to be antigen testing. It can be any form of frequent, affordable testing, but antigen testing particularly leans itself to that. And then accurate reporting, because with that accurate reporting, you can be responsive. So the more schools that participate, the more people that are able to participate too more widely, allows you to get that more accurate data that will actually help reduce cases and reduce transmission.
What is the goal for this program? Obviously, the overarching 30,000 foot level goal is we want to help people, right? We want to help students get back to the classroom. We want to help schools reopen. We want to give peace of mind to the parents and teachers. But what are the practical goals for you and your organization, the benchmarks, where you look back on this a year from now and say, this was a success, or this is what we should have done better? What are those benchmarks that you're looking at?
For DataRobot, we consider it a success just to have the opportunity to reopen schools. And we look at metrics around number of tests administered, number of trainers trained to administer those tests, and then also kind of metrics around how we can test more folks going forward. And then our partners, like Children's Hospital of Philadelphia, will look at the actual health data. DataRobot won't look at that individual health data, but our partners, our medical partners, will look at that test data and try to get an understanding of, is there a risk of children transmitting COVID? Because that's still an open question in some places. And then how did these antigen tests, or did these antigen tests actually mitigate the risk and reduce spread? So overall, we'll be able to look at these schools in comparison to other school systems that didn't use antigen testing to get an understanding of its impact and if it was beneficial.
So what you're really doing here is twofold. One, you are actually putting out a product that is the goal is to help and move schools toward reopening in this fall safely and protecting the teachers and the students as they do that. So that's one goal, that's a very practical, on the ground, we're moving to reopening. And then secondly, this is in many ways an R&D project as well, where you're investing into research and development, expanding sample sizes, and providing data for medical professionals to better evaluate COVID-19 and a lot of these different questions that we have. Am I getting that correctly?
You're getting that correctly. There's so much information that has been published on COVID-19 and in the scientific literature, and obviously beyond into the press and media, but particularly looking at the scientific literature, there have been more papers published in the past year and a half on COVID-19 than there have been ever published on Ebola. And there's some kind of underlying data factors that contribute to why that is. But regardless, there's a ton of information and data out there. So now we have to really figure out which information is accurate. How do we learn from mistakes that we might have made? And how do we prevent this from happening again? So this is data that contributes to helping stop the spread of COVID-19, but it also helps us understand how to prevent and mitigate future pandemics as well.
Sally, thank you for the insight and for breaking down exactly what this program is and the goals and where we're going from here. When we come back, I want to bring up some of the potential challenges that this program may face and have you address some of those. So don't go away. We'll be right back. Welcome back to Face the Issues. Sally, again, thank you for joining us. Thank you for your insights and what the project that you're working on. I want to talk a little about some of the challenges that you and your organization may face, and starting with what has been the biggest challenge that you've faced thus far.
Yeah, there have been a lot of challenges along the way. I think some of the more common challenges that people are probably already aware of to some degree is that there's been mixed information at the local and county and state level, and even the federal level in terms of advice around what precautionary measures are necessary and what people should be doing in order to keep kids and teachers and administrators safe. And that directly impacts the kind of educational understanding of folks and the risks that they want to take as well. And then from this program specifically, what we try to do is make the program flexible for the schools. And so the schools can actually drive decision making around what type of program works for them. But schools have different resources. So, for example, we have set up the program where sometimes teachers need to use their own personal cell phones in order to take photos of the test results and upload them to the rapid testing app. But there are times where schools will provide those resources to teachers. And so we had to build a program that was flexible enough to understand which resources the schools had on hand and how we could be adaptable to their needs in order to make the program successful.
So we had the advocacy director for the Pennsylvania School Board Association on not long ago, and that is exactly what he pinpointed as the biggest challenge, which is the schools are not the same. They're not in the same situations. They don't have the same resources, and that presents very different challenges for reopening. And so that doesn't surprise me. That's been the big challenge. Sally, let me ask about this. You touched on this in the last segment. There is an ongoing debate, often heated, about whether children or what the rate of infection is among children and what the rate of spread is among children. Undoubtedly, some people are going to look at this program and they're going to say, I'm not sure what the need is, that these are kids, they should be going to school, they shouldn't be wearing masks, they are safe. How do you respond to that if that's raised by a school district?
First, there is scientific evidence showing that kids are able to transmit COVID-19. But you're right. In general, they tend to transmit at a lower rate. So, then why do kids have to go through all this trouble? And I would therefore think about kind of the secondary transmissions. What is the risk that's posed to their household if a kid does get sick, and their ability to transmit to their grandparents or even their parents? And then also, even though their kids run schools, there are older adults in the school systems as well. There's teachers, administrators. Those folks do have a risk of contracting COVID-19 as well. And you want to minimize risk to those folks too. You don't want them to also contribute to spread. So anything that we can do to kind of understand the risk of both the students themselves, the teachers, the administrators, and then also minimize that risk, I really think is important in terms of helping reduce overall infection rates. And there's also an opportunity here to learn a lot more. So, this data will ultimately help understand and drive strategy to prevent the next pandemic, as I mentioned earlier. And so if we're able to actually learn from the mistakes that we made in our past, we're going to be able to do better in the future. And this data will help contribute to that understanding.
Sure. And to your point, the transmission rate being low does not mean it's zero. And so
exactly.
Right. The other concern that will be raised is dealing with privacy. You've touched on this a little bit already, but I want to ask you in this sense, the contact tracing, when the idea was first brought up, was very controversial. The idea that there is a database somewhere of everybody who's been in touch with somebody who's had COVID-19. There's a lot of concern about Big Brother is watching, and the concern is not exactly unjustified, that there is a concern of government overreach. A lot of people, parents especially, may object to this level of data on their kids, especially if they know that health departments are going to see it, the hospitals are going to see it. How do you respond to these concerns of data, of just being too much data being given over to the hands of the government or the hands of the hospitals and so forth?
Yeah, that's a criticism that we've heard before. And I think, at a program level, consent is handled by the individual school, and children and parents have the ability to opt out of the program. And if you opt out, there is no world in which you are denied an education. You still get to go to school. You are still going to be in the classroom. In fact, the only thing that we've seen some school systems restrict students' access to is extracurricular activities, because there's even though the risk of transmission is low in children, there is evidence showing that it's increased during extracurricular activities when kids are close together in sports. So in order to protect children's privacy, they have the ability to opt in and opt out of the program. DataRobot itself, we don't look at data at an individualized level. We have no access to any personal information. We just look at a population level as that data feeds into our model so we can understand where spread is occurring. And then our medical partners will look at positive and negative cases. But that is also done in order to stop the spread and keep folks safe. I think when it comes down to thinking about privacy and security, I think part of the reason that we see a challenge with this is just the terminology that we use. We often talk about this as surveillance testing. Surveillance testing means that you're not looking at cases at an individual level. You're looking at the number of cases at a population level in order to understand transmission. But when people hear surveillance, they get their guard up. I don't want to be surveilled. That's a violation of my privacy. So we think just even the terminology that's used around these things can kind of get people to be fearful. So we often talk about this as assurance testing. And assurance testing is knowing, am I sick? Am I safe? And can I transmit to others? And if you think of it more as I want to protect my family and friends, it becomes much less a scary, I have Big Brother watching me, and much more, I want to keep my friends and family safe.
As a former federal government employee, I can tell you that anytime you use the term surveillance, it will never be seen in a positive light. So that's free advice there. Yep. One of the other concerns along those lines is, and this came up with a lot of the athletic groups, right, where they had the NCAA March Madness was in the bubble, and the NBA finals last year in the bubble, where they're constantly being tested. And one of the questions that comes up is there are false negative and false positive tests. To your point, the antigen testing is quicker, but it is less accurate than some of the other tests. And so, and there's still a purpose for it, right? It's a quicker test, but there is a bit of this trade-off. And if we are consistently testing and we're testing a lot, we are guaranteed to have some negative result, or some false negative or false positive results that may then trigger either an outbreak scare or would trigger something in the research. There are concerns of, if we test a lot every single day, we are guaranteed that some of our results will be either false negatives or false positives. How do you speak to that?
Yeah, there are strategies to combat against this. So, first of all, there's false positive results and false negative results with PCR testing too, which is considered the gold standard of COVID testing. But when it comes to antigen testing, one way to easily combat against the risk of false positives is doing serial testing, which means doing multiple tests at once. So if you test positive, you can quickly follow up with an additional test, and then see what the results of that are. And then statistically, if you test positive twice, then you can help mitigate, then understand what your true risk of being positive is. And one reason why this is easy with antigen tests is because their cost and affordability. Usually these tests can be produced easily less than $10, less than $5. Some of them are probably even produced for much less than that, even though they're sold on the market for more. And these tests are, so that allows you to actually do these tests in serial, in replicate, which allows you to be more assured of your results.
And then just the last concern I think that you're going to hear, or you probably already have heard, is the question of burden. And this is something that educators will always bring up, which is, why is the burden on us? Now, you have talked in the past about the idea of simplicity, and that your goal here is to streamline efforts, make things simple, not duplicate things, and make this as simple and let educators go back to teaching and really not give them an extra burden of being doctors in the classroom as well. But there's a training that comes with your program. And so how much of a burden does this put on educators and on administrators? And how do you address that if a district brings it up?
Yeah, I wish teachers didn't have to do this. I feel like teachers have enough on their plate between being teachers, janitors, referees. Teachers do everything, and now we're asking them to administer tests as well. I think overall, the burden, we try to keep it as minimal as possible. In order to train folks, we have a train the trainer program. So a representative from the school will attend a training program, and then that trainer will go back and train the larger group. So we're not asking for the entire staff to come and get training. We're asking for one person to pass the message along. And with that, we've been able to train and scale the number of trainers into the thousands. So that really helps reduce the overall burden. And then we've designed the program to down to the very small details in terms of even how to set up your tables as kids are coming in to get their testing. So you can actually distribute the work amongst 10, 20 administrators. So you can get kids in and out very quickly and help them maximize their time in the classroom. And we also take feedback all the time. Anytime that we hear from a teacher or parent that they feel that there's a challenge or a burden, that's something that we can address with our technology and the app itself, or we can update our protocols and procedures as well. So we take feedback very seriously, and we try to design this in a way that reduces that burden from teachers so they can maximize their time in the classroom.
All right. And Sally, last question in this segment. If a school district is watching and says, hey, we'd like to reach out, where should they go for more information?
Yeah, they can check us out at rapidtestingapp.org. And they can get all the information from our procedures and protocols. They can exactly see what the process is like, and they can reach out to us for additional information as well.
Again, the website is rapidtestingapp.org. Sally Embrey, thank you again for joining us. Don't go away. We'll be right back. Welcome back to Face the Issues. Sally, again, thank you for joining us. Thank you for the work that you and your organization do. Now, a lot of times on our show in this last segment, we like to take a moment just to get to know the guest, get to know what makes Sally Sally. And so one of the questions that I love asking our guests is, what is your why? What gets you up every morning? You've talked about what you do. You've talked about your organization, this program that you have introduced. But what's your why? What are your passions, and what makes you do what you do?
Yeah, I love public health. I'm such a public health nerd. Like you mentioned at the top, I'm an epidemiologist by background, and I love the potential that public health has and the ability to make people have more informed decisions about their health. And it's always been a passion of mine to understand how we can ensure that people are living a better lifestyle, a healthier lifestyle, and being able to also take ownership in decisions of their health. So what motivates me getting up every day is knowing that I'm having a direct impact in terms of helping fight back the pandemic, but also helping prevent those future pandemics from happening again. And hopefully saving lives in the process. I'm not a doctor. I'm not on the front lines or in the operating room. So, and I so grateful for the work that those folks do on the front lines every day. I can't say I do the same, but I do believe that I'm having an impact. My organization is having an impact, and that's what gets me up every day.
Sure. Well, we each have a part to play, and you're certainly playing yours. Sally, we said, you mentioned as well, you're an epidemiologist by background, also an engineer. We have some young people watching this who say, that is so cool, I want to do what Sally Embrey does when I grow up. What advice do you have for them?
Yeah, I think one of the biggest piece of advice is find what you're passionate about, follow that passion, and then look. I really try to follow I'm a science nerd too. I follow the scientific literature. I see like what trends are emerging, what people are interested in, and I kind of get excited when I get to see new research come out and what the potential for that research is. So my dorky response is look at the scientific literature and see what excites you, and then follow down that path.
That's fantastic advice. Sally Embrey, thank you again for joining us. Thank you for your expertise. We wish you all the best as we head into this new school year, and we look forward to hearing about the success of this program.
Thank you so much. Thank you for having me.
It's our pleasure. That is our show for tonight. I want to thank Sally Embrey from DataRobot for joining us. And I want to thank each of you for tuning in, and hope you'll be back with us right here next week. Until then, my name is Sam Chen. On behalf of all of us here at Face the Issues, thank you and good night.